Well, I don't think you have to log out again. I don't think you have to. Oh, okay, gotcha. Gotcha. Okay, uh-huh. Yeah, but I have to drive it now, so it's just a lot. It's a lot. I don't understand.
Hi, everyone. Thanks for joining. We'll get started in a few. If everybody could just make sure to mute your line, that would be great. And Torlin, I think if you're dialed on yet, if you could find a way to mute everybody to start, that would be great. Thanks. Hey, everyone. So I just want to make sure everybody can hear. We'll give people maybe 1 or 2 more minutes because I see people still joining. If you can hear me, if you could send a message in the chat box to organizers and panelists, that would be great. Make sure to include panelists because that way I can see it. And Torlin, while we're doing that, I think it looks like I have control of the slides. So I'm just going to try to get it out of this duplicate mode. Thanks. And Torlin, I think I can actually advance the slides myself, so you won't have to do that for me. Great. And okay, great. So if everybody could mute, if you're not the one talking, that would be great. I think Torlin, I'm getting a little background noise from our All Chicago office. And I think we're almost at full attendance based on the number of people we expected to join. Just going to give it 1 minute for people to figure out their mute and unmute. And while we're waiting for other people to sign in, there's a couple of housekeeping items that we just want to make sure people are aware of. So again, I asked if people can hear me, if you could go ahead and open up the chat panel. It's shown here in red, and just chat to the organizers and panelists to let us know you can hear us. That would be helpful. And Torlin, if you are getting any messages with people saying they can hear, would you let me know? All right. Oh, we're still seeing people joining, so we'll give people another minute or so. Torlin, are you on still? Okay, great. I haven't seen any messages from people saying they can hear us. Have you gotten any messages? Okay. So we'll just ask one more time if you can hear us. I don't want to proceed until we are confirmed that the audio is working. This is the week for all glitchy technology. So if you can hear us, please put in a message to the organizers and panelists that you can hear us. And Torlin, will you just try to double check on your end that everything's set up in a way that people can hear us?
Okay.
Okay.
Okay, so Betsy said, thank you, Betsy. So, Torlin, if you want to just make sure the chat is turned on, it's a couple of people said they can hear, but they can't chat. So because people can hear, we'll go ahead and get started. I don't want to keep you waiting, and then we'll figure out how to get the chat functionality turned on so that we can chat throughout the call today. So while we're getting going, and Torlin, if you can advance to the next slide when you get a chance, what we're hoping that we can cover today is to talk through all Chicago's plan to support the COC as we're working through this response to coronavirus together. So I'll share a little bit about what we're hoping to do, and then we'll switch into the discussion of what else do you need. And at that point, if people have to start jumping off, I think that's totally fine, because the second half of the call, what we're hoping to do is talk through some of the guidance, summarize the guidance that we've seen come out, and then do some peer sharing and question and answer. And so those, I understand that a lot of people have been on calls that kind of have similar topics. So if you have to jump off, that's fine. We will also be taking notes and providing a summary of what is discussed on the call afterwards. So if you need to redirect your time for the second half of today, please know that you won't miss out. We'll make sure to get you updated. And then we'll wrap up by talking through some next steps about what All Chicago can do to continue to be a supportive partner during this really difficult time. So thank you all for joining. I think I forgot to say that this is Nicole Bahina, and I'm All Chicago's Vice President of Community Partnerships. And for many of you, this might be the first time you're hearing from me, and I'm sorry we're meeting under these circumstances, but my vision for All Chicago's role in this response is that we continue to help you all as you're rapidly developing best practices during this topic to help promote, cross-sharing of best practices, innovative ideas, and just really help make sure that we band together during this difficult time to keep things going and supporting the people who are experiencing homelessness. And Torlin, I think I'm just still getting a little background noise from your computer for some reason. I think if you want to try to mute, that would be great. Okay, so let's go forward one more slide, and I'll just walk you quickly through the 3 areas that we're focusing on in this effort. Let's go forward one more slide. So one of the things that many of you have probably heard us talk about already is that we are trying to create and manage our emergency funds in a way that is extremely flexible and responsive to the coronavirus epidemic. So we are trying to not only identify and secure new resources, but we're trying to figure out how we're using all of our emergency funds, whether that's state homeless prevention fund dollars or any new resources or student emergency funds. We're trying to figure out how do we maximize the flexibility of those funds to enable people to respond to this crisis. So we are actively working to identify new resources and create an emergency fund for providers. We've heard a lot from providers about all of the either expenses that are increasing as a result of this or needing to buy additional supplies. And so we are trying to identify some resources. At this point, I can't say any more than that, but we will, as soon as new information is available, be sending out an email to our partners, and we'll try to contact people in as many ways as possible about that. Another area of focus is to promote rapid communication and peer sharing. So we're creating, and hopefully we'll launch today or tomorrow, a dedicated web page on this topic just to help serve as yet another resource for people to go to. I want your opinion and feedback on whether this Slack channel idea or a place where we have a communication channel for people to communicate about is a good idea or not. So we'll talk more about that later. And then we have a whole team of people at All Chicago who are really dedicating themselves to distilling and summarizing all of the guidance that is being produced either from CDC or HUD or DFSS or CDPH. We're going to be having those people sit in on upcoming webinars and producing summaries so that if that's helpful to you, then you don't have to always be everywhere. I know there's so much going on right now, so whatever we can do to be helpful, those are some of our ideas, and we'll check those with you to see if those are the right ideas or if we should be doing other things in a little bit. We're also looking at how we can relax rules and requirements for All Chicago programs. So many of you know that we have an intent to renew process going on for HUD NOFA projects, or COC-funded projects. We're looking at, and we're able to offer extensions if you need more time to respond to some of those items. We're waiting for confirmation from DFSS about relaxing some of the rapid rehousing program requirements during this time. We're talking with CSH later about any changes that are going to be related to the coordinated entry system. And then, like I mentioned before, we are looking at our state homeless prevention funds and flexible emergency funds to see what our options are about how we can make sure that those are going to support people during this difficult time. So now that we have talked through some of those things, and I want to see, Betsy, maybe if you could either chat or email me if the chat function is not working, because that'll change how we do this the rest of this webinar. So either put in the chat, or you could just email me if you're still not able to chat, and then we can come back to those ideas about what All Chicago is doing. So let's go into our guidance summary here. If you want to go forward one more slide. So like I said, this guidance is mostly what was on DFSS's webinar that they held for DFSS-funded delegate agencies. So some of this might be a little bit of a review, but it is some of the basic information that will help you be able to respond and build out a response for your agency as it relates to this. So as we know, COVID-19 is a respiratory virus. It's primarily spread in the same ways that cold and flu are spread, by droplets from coughs and sneezes. The symptoms include cough, fever, and difficulty breathing. And for the majority of people, the immediate risk of being exposed to the virus that causes COVID-19 is thought to be low. I think at the time that DFSS published this on Friday, although we may think that the statement might not be true still, but there was not widespread circulation in most communities in the United States at that time. If we talk about, can you go forward one more slide, Torlin? So one of the reasons why we are so concerned about this disease among the population that we serve is because we know that a lot of the people who have experienced chronic homelessness or are currently living on the streets fall into a high-risk population. So that's older adults or people with underlying medical issues. They're at a higher risk of serious illness. If you are currently serving people at your shelter or program and individuals are over 60 or have underlying medical conditions, we want to think about how we can create a plan to monitor their well-being, and I would love to help have future conversations about how groups are doing that. And just so you know, as of today, there are no confirmed cases of COVID-19 among people experiencing homelessness. And I know some of you probably would say that's because testing is not widely available, but just as of today, there are still no confirmed cases. Denise, I don't know if you're able to unmute yourself. Probably not, because I think we have global mute on. But if you are able to unmute, then you could provide a little bit of guidance about what DFSS is recommending if people are presenting symptoms. So we'll give her a second to see if she can unmute, and if not, I'm happy to share that as well. Okay, so what we heard on DFSS's call, and this was on Friday, is that if people are presenting with symptoms, but they're not really struggling. Oh, okay, I think Denise, you might be unmuted now. Do you want to jump in? Okay, Denise might be double muted, so that's okay. We're clearly trying to rapidly put everything together just like everyone else is, and so the technology difficulties are really rearing their heads today. But basically, what the DFSS and CDPH guidance is that if somebody shows up to your program, or you're working with somebody who is presenting symptoms, but they're not either having trouble, difficulty, or really in an emergency situation, then the recommendation is to call CDPH's hotline, and we'll provide that number to everybody after the fact. So if they are showing up and they do have severe symptoms or difficulty breathing, then just like you would kind of triage that situation in a normal non-coronavirus era, you would call 911 for an urgent assistance for that person. Let's go to the next slide. So some of the best advice that we've heard is really related to how you address these new situations. As you probably have witnessed and experienced at your own agency, there is no playbook for how to do this. And even though All Chicago and CDPH and DFSS and HUD and CDC are all working to put out as much guidance as possible, this is the time where, as many of you are social workers, we have to put on our sort of innovation hats and figure out how to take each case by case and what works for your agency. And so while we can provide guidance, like on the slide here, that's what we're hoping to do, is to really provide a cross COC peer sharing rapid communication channel so that people can learn from some of the other people who are experiencing things and doing innovative solutions as well. So whenever you're addressing a new situation and you're not quite sure what to do, feel free to reach out to CDPH's hotline, send them an email, review the guidance there. CDPH is our primary go-to source for information here, and they are updating their page, which is chicago.gov/coronavirus, even for situations as they relate to high-risk populations and for community organizations. Let's go to the next slide. So this is not new for anybody, and we're going to kind of gloss over this because I feel like most people have already seen this in some form or another. If we want to go to the next slide, I really appreciated what Google put out as sort of the 5 things that people can do to help stop coronavirus. So if you just Google do the 5, this will pop up, and I feel like it's a really great way that people can easily communicate to staff and to the participants that you're serving some of the basic things that we can do to help stop coronavirus from going around. All right, and Torlin, are you seeing any chats coming in yet? All right, maybe you can put in the chat box if you're seeing anything. Thanks. So in terms of preparing staff, obviously most of you have already done these things. Actively encourage people to stay home, consider waiving the requirement for healthcare providers, note for employees who are sick, remind staff about good hygiene, continue routinely cleaning all frequently touched surfaces. And I know finding resources for doing this can be difficult. Finding actual supplies or money to buy the supplies. And so that's a concern that I know the coalition has been working on advocating for, and hopefully we'll have some more information on a response for that. And then making sure that staff know who will be communicating additional information as it's available is critical. So make sure that you have at your agency your own communication channels to regularly communicate about this throughout the agency. So this is some of the best, most high-level advice or guidance that we've seen in terms of preparing your staff. And if we go forward one more slide. So I know DFSS has been providing a lot of guidance to emergency shelters and outreach providers. And Torlin, I just want to flip back to the slide if you can. So DFSS has been providing a lot of guidance on emergency shelters and outreach providers and drop-in centers, but not a lot of guidance has come out related to affordable housing or permanent supportive housing providers. Can you go forward one more slide? So what we're trying to do here is just summarize some of the things that you can do, and on our website we'll have a list of a checklist that you can run through for if you're a housing provider. So helping program participants secure essential supplies like medication, food, water, just in case they're asked to not leave their home for a couple weeks. Educating program participants on the infection prevention and what to do if they think they're sick. Refreshing emergency contact lists for residents can be helpful, and then making sure residents know which organizations in the community they can go to in the case of an outbreak. So whether that's for mental health services, accessing food, other supplies, it might be connecting them back to their primary healthcare provider, or if they don't have one, making sure they know where their nearest FQHC is and things like that. If we go forward one more. And I am seeing some chats coming through, and so that's helpful, and we'll get to those in a little bit. So for the guidance summary for emergency shelters, we told DFSS that we would help spread the word about some of the best practices coming out of the guidance geared towards emergency shelters. So this is not new information, but we do feel like it's important to make sure that everybody's receiving the same message. So for emergency shelters, DFSS is recommending that you activate your preparedness plans and take precautions with staff and guests and educate them to help prevent the spread of COVID-19. Triage situations and communicate them to CDPH. So again, we'll send out that email address as well as the conference or the call-in number where you can call and keep them up to date and receive guidance from a live person. If you're DFSS funded, you're supposed to email every day the number of residents who are in that vulnerable category, and they've provided instructions for how to do that. And then also provide adequate supplies for good hygiene, including easy to access clean and functional hand washing stations, soap, paper towels, and alcohol-based hand sanitizer. So we know that, again, getting those supplies can be difficult, but just do what you can at this point. There's a few more on the next slide, if we go to that. So increasing the frequency of cleaning your facility, referring guests who have concerns to their healthcare provider or the nearest FQHC would be great. And there's also a place where you can get a list of the closest FQHCs, and then have a communications plan in place in a location within the shelter if possible. We know that's not possible in every shelter situation, but where you could set someone aside who is symptomatic and needs to be isolated until health officials or transportation can be provided. Especially if you're a DFSS delegate agency, they're going to be communicating mostly via email. And so just, stay on your email as much as possible for additional guidance there. Great, and let's go to one more slide to summarize the guidance for outreach and drop-in centers, and then we'll get to some of the questions. And thanks so much, Torlin, for forwarding me the chats. So for outreach and drop-in centers, again, this is guidance from DFSS that we wanted to share and make sure everybody's on the same page. So as much as possible, practice social distancing when you're interacting with participants. The guidelines for that are here. Identify healthcare options, like I said before, find the federally qualified health center in your assigned geographic location, and then help educate people as much as possible. So on our website, we'll try to include easy to print materials that you can pass out to people. And I'm sure you've already either created something yourself or identified some. There are a lot are out there already created, so I wouldn't recommend starting from scratch. But as much as possible, I think case managers are likely already doing this, but to just incorporate this into the conversations with people in whatever way makes the most sense. We know that this is a time of heightened anxiety for everybody, and sometimes that can be exacerbated by people who are already, living on the streets or have chronic health or mental health conditions. All right, so what we will do, I'm going to look through some of the chats for a second here. I'm hesitant to unmute everybody because there's about 150 people on the call, and I think we'll get a lot of background noise. So while I'm combing through the chats, I would love if people could just share in the chat box whether they feel like it would be helpful if All Chicago created a cross COC communication channel that is web-based and where people could share best practices, put questions, and we could share information. And just an example of one type of information that might be helpful if we do create this cloud-based environment where people can chat. So Michelle Gilbert from Legal Aid emailed All Chicago this morning and just said, hey, there's going to be no evictions during this time because the courts are shutting down and the city is trying to, avoid evictions happening as much as possible. But that doesn't mean that some landlords won't try to take this as an opportunity and either discriminate against people, lock them out, or things like that. And so she wanted everybody to know that Legal Aid is remaining open and that they're staffing up to be able to prepare a response for some of those types of things. So those are the types of communications and information sharing that we could put in this. We've identified it's a slack.com channel is what it's called, and we can test it and run with it, but we don't want to do that if people feel like that's not helpful. We could also create a Facebook group. So any thoughts you have around that can go in the chat box, and Torlin, we can just connect on those later. We don't need to forward those. All right, so I'm going to read through a couple of questions. How should we secure essential supplies if we should not be in contact with them? Is Meals on Wheels providing additional supports to homebound folks that we could tap into for individuals who are in PSH and have a significant need? That is a great question. I don't know the answer offhand, although I'm sure other people on the call do. So I'll pose the question one more time, and if people want to put in the chat box the answer, and then we can summarize out the answers after the fact. So again, the question is, is Meals on Wheels providing additional supports to homebound folks that we could tap into for individuals who are in PSH and have a significant need? So we'll see if anybody knows of any ways that they're getting meals or food support to people who are in PSH or other affordable housing and might need it. If you could throw that in the chat box, and we'll circulate that back out to everybody afterwards. Great. The next question is, my understanding from the Chicago Department of Family and Support Services was that the call-ins were for shelters. Does this apply to all programs that they fund? We can double check on that. Denise, feel free to message me if you feel like that number was just for the shelters, but it's my understanding that CDPH has a hotline that's shared on their website that everybody could call if they need further guidance. Great. And then there's a question here also for individuals that are matched to housing. So the question is, for individuals matched to housing, is there any plan to move clients into housing quickly regardless of documentation? With offices closing, it may be difficult for housing navigators to assist the clients with gathering all of the documents required for PSH. I totally agree. And if anyone has other examples of either requirements or documentation that should be relaxed during this time as it relates to PSH or coordinated entry, please put that in the chat box. We are certainly happy to take that information to HUD, and we have a call this afternoon with CSH to talk about coordinated entry and what needs to be temporarily adjusted for this time. So if there's anything related to coordinated entry that we should be looking at, please go ahead and put that in the chat. Great. Someone said, FYI, FQHCs are not testing for the virus. Someone said, I'd love to see the facts versus the myths flyer. There's a lot of fake news flowing, so we can make sure we find something that addresses that. Someone asked, is it public information that there will be no evictions? Can we share this with partners and or more broadly? My understanding, and this is again from Michelle Gilbert at Legal Aid, she just said that civil courts are closed starting tomorrow for a month, except for emergencies like domestic violence orders of protection. No eviction orders will be entered or enforced during this time. This is great news. And then she goes on to, address some of her other concerns. I'm sure that information is available publicly then if Legal Aid has the information. Great. And someone asked for DFSS delegate agencies, can we provide the email address for those, for who you should be contacting at DFSS to report the daily numbers? And we can circulate that around afterwards. We're happy to just kind of put the DFSS guidance into an email and circulate that. Somebody is curious about how other permanent supportive housing providers are handling tenant guests. And this person says they plan to start restricting or recommending guest visitation, beginning tomorrow. So if others have ideas on that, put that in the chat and we can circulate that around afterwards. Great. I'm just sifting through other questions. There's so many coming in, which is really great. Even though we don't have all the answers today, that's okay. One of the main reasons why we wanted to convene this group is to start understanding what questions haven't yet been addressed. I'm hoping that after this week, people won't have to join 4 or 5 or 6 different webinars, but right now, I think it's okay that you're hearing from a lot of our system level partners saying, please join us, help us figure out how we can help you in this. So even though it may feel burdensome, I'm hoping that we'll be all on the same page and able to join forces going forward. Great. So here's another question that we don't have the answer to, but we can work on it with DFSS. If we go into mandatory quarantine, similar to Italy, is there guidance about how shelters should manage staff? We can talk to DFSS about that. And can we work on a plan to reach out to tenants, especially anyone in a tax credit or trust fund unit, to get emergency assistance, especially those 2 programs because they do not fluctuate with income? Yeah, and some of the things that All Chicago is trying to think about is not only responding to the immediate crisis of today and tomorrow, but how do we anticipate what the homeless prevention needs are going to be in a few months when either people's income is less or is gone because of people just staying home and businesses needing to close. Okay, this is great. We're going to provide a summary to a lot of the information that people are putting in here. And I love all these ideas about relaxing requirements. And we're working with the Chicago Coalition because there have been a lot of really good ideas that have come up on those calls as well. So again, if you haven't already weighed in on the need to establish a communication channel where people can kind of ask questions and get information, please put that in the chat box. And Torlin, would you mind going forward 1 or 2 slides to slide 20? Thank you. So like I said, one of the main reasons that we want to convene this group today is to figure out what are the right next steps for All Chicago to support you as individual people and as agencies in serving people who are experiencing homelessness. So these are kind of some yes/no questions. And if I feel like the way we can handle this is if you feel like one of these things would be really helpful, just go ahead and put it in the chat box as a yes, as a strong yes. And then we can go ahead as a next step and make that happen. So would it be helpful to keep an All Chicago website updated? Would it be helpful for us to monitor and support that Slack rapid communication channel? Would it be helpful for us to identify financial resources and publish application process ASAP? I can kind of guess that most people would feel good about that one. I'm not sure about this last one here. We are happy to convene providers weekly and figure out next time the technology so that we can actually have this be a dialogue and less one way. But if it's too burdensome to convene people, we don't want to do that unnecessarily either. So I would really love your thoughts and feedback about whether convening people for a weekly webinar is going to be helpful, or if it's just going to be another annoying thing that you feel like you have to do because you don't want to miss out, but might not be that helpful. Okay, seems like, okay, a lot of responses to yes to the webinars. That's great. Okay, yes, there's strong yeses on all of these things. So then the last question I have for you is, in addition to kind of combing through the questions today and circulating back some thoughts about that, what else can we be doing to help you all in your response to this? Is there anything else that we can be doing? Just go ahead and put it in the chat. And then what we'll do, we have about a team of 8 that is dedicated to helping All Chicago respond and be good partners in this. And so we will make sure that we put together all of the ideas from today's call and make a plan for doing those. Great. All right, I'm just taking another minute to let people put in the chat box and also comb through a few more questions in case there's been any helpful tips that people have put in here. As you can imagine, there's a lot of good questions and not as many helpful tips yet, but that's okay. And like I said, we'll help try to promote the peer sharing that will be necessary to help everyone feel like they're responding as best they can. So food resources are going to be a huge issue. It'd be great to figure out a plan or to contact the Chicago Food Depository to find out how we can have a coordinated response. I think that's a great idea. We've heard this request before about advocacy around some form of hazard pay or time and a half pay for frontline staff who are unable to remotely work. Great, and then identify available resources for shelters, especially at supplies. And prices are starting to jump. All right. I think I'm hearing a little bit of background noise from, let's see who's doing that. We can just turn that off. Torlin, I think you could probably mute wherever that background noise is happening. Okay, so on another note of how All Chicago can be helpful, someone suggested to provide a webinar on how to get unemployment for staff or participants. It's a great suggestion. Other ways that All Chicago can be helpful. I think someone reminded or wants to remind everybody that DFSS sent out an email about food for shelters. So if you operate an emergency shelter and didn't get that email from DFSS about the Salvation Army providing food for shelters and the coordination with the Greater Chicago Food Depository, I think you could reach out to your contact at DFSS for that. We can also circulate a response. This is an interesting suggestion. Can a flyer or a one-pager be created to give to landlords to convey rules regarding non-payment of rent due to COVID? We can definitely look into partnering with legal aid about doing something like that. Okay, so I know, let's go forward one more slide, Torlin, and this will be the last slide that we spend some time on. And it's mostly just a summary of what I think some of the provider next steps are, and we'll provide links and an appropriate summary from today's session that you can review. But I know that there are a lot of surveys going on right now. So I know DFSS sent one about food support. So that came from Christine Riley. There's also another DFSS shelter communication survey that came from Commissioner Butler, sent to the executive directors. So like I said, there is a lot of convening and information gathering going on right now. And even though it feels burdensome, it's the primary way that your needs are going to get met. So at All Chicago, we committed to not doing a survey because we are partnering with all of the other partners who have surveys so that we can help that shape the emergency funds that we're hopefully going to be able to build, and some of the other information that we can do. So we don't have our own survey, but please fill out the surveys if you have them in your inbox. If you want to stay up to date, we'll send information for joining the Chicago COC Slack channel. It seems like there was good feedback on that. Some of you are already in there. And then also just sign up to receive CDPH alerts. So we'll provide instructions for how to do that, but that's the primary way that they're sending out communication. And so there's a special list that they're creating to help with that. Obviously, you guys are all becoming experts on the guidance that is available to you. We're going to do our best to distill that and post it. It's so rapidly changing that, that's why we haven't posted something yet, because I feel like every day it changes. But the key places where you have information at your fingertips are from the Chicago Department of Public Health, Department of Family and Sports Services, us. So when we launch that webpage, we'll continue to update it. And then HUD and CDC has put out a lot of guidance as well. And then most of you have probably already done this, what's in this last box about convening a COVID response team at your agency. It's what we've done at All Chicago. It's probably what you all are doing now. But just to participate in either the shelter planning exercises like this webinar or like with DFSS, or even doing simple things like establishing a communication plan to get information throughout the agency quickly. That's all part of being a response team and what you should be doing at your agency. And I know you're doing those as well. We can dedicate one of our webinars and maybe a portion of the next one that we do to having some tips about how people are managing this at their agencies. And we can certainly create a spot in the Slack channel for that discussion to continue as well. Someone on my team before we go, I think, wants us to ask what communication channels are most helpful to people, whether it's email, social media, all of the above. So if you want to just drop into the chat box what you feel like would be most helpful, that would be great. I know many of you are probably members of the Homeless Hub, which is a Facebook group, and it's highly utilized. And so that's another type of place where we could help promote rapid communication. All right, well, we will keep the chat box open for another 10 minutes or so as people are sort of finishing their final comments. Remember, the main questions that we want answered today is how we can be most helpful to you. So if you have an idea of something that we should be doing, or you have a question, we can't promise we'll be able to answer it, but what we can do is start to bundle all of the questions into themes that will then help us get guidance from CDPH or DFSS or some other entity. And so we're happy to help play that role. And then it sounds like there was some positive feedback about doing regular convenings. And so I will talk with the coalition and with DFSS about if there's a possible way that we can kind of combine forces on those, so that not everybody's not in 3 or 4 or 5 different webinars every week, but maybe we could do one and have everybody come together. I feel like that would be, if I were in your shoes, I think that I would appreciate that as well. So thank you so much, and apologize for some of the technical glitches. I think that even the technology is trying to keep up with what we're experiencing right now. But I appreciate you all so much, and please let us know how we can be helpful, and we'll send out an email probably today or tomorrow with a summary of what we heard today. Thanks, everyone.